Welcome back to another episode of PT Meal Physical Therapy Podcast, your weekly serving of insights, information, and inspiration about the physical therapy profession and practice from the experience and expertise of physical therapists around the world. I am Johan de la Paz. Let's go on with the show. So, in this episode, we are going to talk about another interesting topic, somewhat of a niche practice, if you can call it that way. It's men's pelvic health from the perspective of a male physical therapist. So, I have today Dr. Lance Frank, the owner of Flex PT ATL in Atlanta, Georgia. Dr. Frank earned his doctorate in PT from Emory University and his master's degree in public health from the University of Missouri. He received his training in pelvic floor from Herman and Wallace, Alcove Education, and Pelvic Guru. He treats all gender with pelvic floor dysfunction, including incontinence, sexual health concerns, pelvic pain, constipation, and LGBTQ plus related issues. So, welcome to the show, Lance. I'm excited for our conversation today.
Me too. Thanks for having me. I'm excited to talk about it.
Before we dive into the topic, could you give us a little background on how you started your journey as a physical therapist? How did you become a physical therapist, and what led you to your current practice?
Sure. So I was a three-sport athlete in high school. I was very active all through, in elementary school, middle school, high school, very active in sports. I played, like I said, three sports most of my life. Basketball was my favorite, and probably the one that I was the best at. Um, And my senior year of high school, during my senior basketball season, I got injured and I needed to go. Up until that point, 17 years old, I had never had experience with physical therapy before, but I got an injury my senior year of basketball and I needed to go to physical therapy. And, the therapist that I worked with, she was amazing and she made therapy fun. And that was really kind of my first experience with PT. And I was like, this seems like a pretty cool gig. So I pretty much made up my mind after I finished, my plan of care with her and finished out the rest of my basketball season and graduated high school that I was going to be a physical therapist one day. That was I kind of made up my mind and kind of stuck to it. So I went through undergrad with that same exact plan. I never changed majors. I started out as pre-PT and kind of finished that way. And so my senior year of undergrad, I went to the University of Missouri, go Tigers, and I only applied to one school and I didn't get accepted to that school, which was, kind of a heartbreak. But so I kind of had to go with my plan B, and I had always had an interest with public health as well. So I started a master's degree and finished that from the University of Missouri as well. I got my master's, and then my second year of the master's program, I reapplied to PT school and I got accepted to Emory down here in Atlanta. So I moved to Atlanta and I finished my degree here. And during my last ortho clinical rotation, um, one of my clinical instructors had kind of put the idea in my head of pelvic floor dysfunction, like or pelvic health in general. And at that point, and I don't know about your PT career, but we got one lecture over pelvic floor dysfunction, and it mostly pertained to pre and postpartum people with vaginas. So it wasn't a whole lot of information regarding pelvic health. So when my clinical instructor had asked, she was like, would have you ever thought about pelvic floor? Because she did half pelvic floor and half ortho. So she had asked if had ever thought about pelvic floor, PT, or and at that point I was like, I don't know anything about pelvic floor PT, but I mean, it sounds interesting. Like I'll learn a little bit more about it. So I took my first course in pelvic floor my last semester of PT school. And then right out of PT school, so I graduated in May. I started my first ortho slash pelvic job in January. And at that point in my career, I had only really heard of like a small handful of other men that were treating pelvic floor dysfunction, and they were mostly all on the West Coast. So it was like Seattle and LA and San Diego. I didn't really know of anyone on the East Coast that was treating pelvic floor disorders. So I thought that was kind of cool. being one of the first at that time. So I thought one of the first male providers treating pelvic floor. So that's kind of how I got into it, and kind of my, I guess, trajectory of physical therapy in general.
Mhm.
So yeah.
Yeah. So you were wondering, for us, because I studied in the Philippines, and we didn't have any semester or focus on pelvic floor. So
Oh,
yeah, so the only time that we encountered just remotely a topic on pelvic floor is in therapeutic exercises about pregnancy. So that's it,
right.
and
Yeah.
that's the only thing that we discuss about anything about pelvic floor.
Very, very little, I feel, goes into in terms of pelvic health, goes into the physical therapy curriculum, which I feel like is a disservice to all PTs in general, because the pelvic floor plays an important role of your
Mhm.
core. And I it, I would almost argue that all therapists should take at least a pelvic floor, like an introductory pelvic floor course, because it
Right.
is such a vital component of, orthopedics. And even you said that you started in skilled nursing, and, incontinence is huge in skilled nursing facilities. So I
Mhm.
feel like in terms of therapy, I feel like PT curriculums do us a disservice by not covering it more. And
Mhm.
like I said, we got one lecture over pelvic floor in my entire 3-year, doctorate program. So,
Mhm.
um, but yeah, it's something that's not really talked about when you're going through your education.
That's right. So when I was telling you, when I was in a skilled nursing facility, I had a lot of questions from my male patients that, oh, can you do anything about my incontinence? Because they came from the hospital, having those indwelling catheters, and
Yep.
most of them would really ask me, are there exercises that I can do, or can you do something in physical therapy about my incontinence? And my usual answer then was like, I guess you have to talk to your doctor about that, because I wasn't really, I can't really say that I'm knowledgeable about that topic. So,
Right.
and I don't know if it's gonna be part of billing. I mean, providing um, pelvic floor exercises, is it part of the therapeutic
Right.
exercises bill? So I wasn't sure. That's why I attended the course from Herman Wallace. So
Yeah.
going into pelvic health, pelvic floor, and you already mentioned how that interest got you in there. So how did you, or what is the steps that you took so that you learn more about pelvic floor, and you're gonna like concentrate or have pelvic floor as one of your main practices?
Sure. So, like I said, the first course I took of
Mm-hmm.
pelvic floor was my last semester of PT school. So
Mm-hmm.
before I even graduated as a licensed clinician,
Mm-hmm.
I took just like Herman and Wallace's first pelvic floor introductory course. It's mostly um, female pelvic floor dysfunction
Right.
surrounding incontinence. So
Mm-hmm.
it's very, entry level type course. And it gives you a foundational knowledge to treat that. And
Mm-hmm.
from that, you can sort of use clinical reasoning and doing your own research if something outside of that realm of, the diagnoses that they teach comes up. And that's
Mm-hmm.
kind of honestly what I did. I took the first course, and over the course of, I guess I've been out of school 4 years now. Over the course of the last 4 years, I've just kind of spaced out my continuing education courses, and I've, based on clinical experience and just seeing patients in the
Mm-hmm.
clinic and taking these continuing education courses. Like you mentioned, I've taken courses through Herman Wallace and
Mm-hmm.
Alcove Education and Pelvic Guru.
Mm-hmm.
So I've just kind of combined all of that knowledge, and that's helped guide my clinical practice
Mm-hmm. Going
over the
to
last several years.
All right. Going into the pelvic floor practice, was as a male practitioner, was there any qualms or any doubts in your mind, or were you worried that not many people might need or see you for pelvic floor rehab?
I get that question a lot
Mm-hmm.
actually. And when I started out, honestly, I guess because I was naive to it.
Mm-hmm.
I don't know. I like to think that I give off a very non-threatening or, a very friendly vibe personality. So it never really kind of was in my head that people may
Mm-hmm.
not come to me because I'm a man.
Mm-hmm.
Um, but through clinical practice, I've only ever had, I mean, and I don't know what goes on behind, closed doors when people are scrolling on the internet trying to find a provider. Like, I don't
Mm-hmm.
know what's going through their thought process, but at least in front of me, the patients that I've had, I've only ever had one patient that she didn't refuse services or therapy. She just refused to, she declined an internal exam and
Mm-hmm.
she just wasn't comfortable with it. And I said, that's fine. We can, treat it in other ways.
Mm-hmm.
But outside of that, I haven't had any sort of kickback
Mm-hmm.
for being a male provider in pelvic health.
Mm-hmm.
I will say, and I don't know again how naive this is of me or not, but I'm openly gay. I have a partner that I've been with for 5 years. I talk about him open and freely, and I'd be remiss if I didn't admit that I think that plays a part in,
Mm-hmm.
the female level of comfort, being feeling comfortable with
Mm-hmm.
me. I think that, at least outwardly, I don't necessarily project a very heteronormative, type of way about me.
Mm-hmm.
I feel like being open about being gay, and I make it very clear on my website and my referral, I have a large referral network of like sex therapists and mental health therapists and massage therapists and some urogynes and OBs, and most of them know me on a professional level, but also on a personal level. And so there's a lot of, I guess, gatekeepers before patients even get to me
Mm-hmm.
that A, I'm a man, B, I'm gay, and C, I have a doctorate degree that says that I can do what I do. So
Mm-hmm.
I've never had any kickback,
Mm-hmm.
fortunately, thankfully. Patients
Mm-hmm.
have, if they're coming to me, it's because they want to come to me and
Right.
they feel comfortable seeing me,
Mm-hmm.
thankfully, fortunately.
So having that network is really good. So how did you build up that network of doctors, practitioners around you in your practice?
Honestly, it's just kind of pounding the pavement.
Mm.
Well, for one, there's not a lot of male, as we've been discussing, there aren't a lot of male providers doing
True.
pelvic floor physical therapy.
Mm-hmm.
So, especially on the East Coast, like I mentioned.
Mm-hmm.
So, being one of a few,
Mm-hmm.
it kind of not raises eyebrows, but, perks some ears up whenever they hear there's a man treating pelvic floor dysfunction.
Mm-hmm.
So, it's kind of like a wow factor that's
Mm-hmm.
really helped. So talking to different people, going around being like, hey, this is who I am, this is what I do, this is the population of people that I can treat.
Mm-hmm.
If you have anybody that fits into this X, Y, or Z diagnoses, like
Mm-hmm.
they may benefit from therapy.
Mm-hmm.
So when I first started, and don't get me wrong, this has been a buildup of the last 4 years to get me
Mm-hmm.
to where I'm at right now. But when I first started, it was a lot of going and marketing to different people, different providers, chiropractors, massage therapists, doctors, nurses, nurse practitioners. So anyone that sees anyone with pelvic floor disorders, I was going to and introducing myself and passing out business cards. And so I've been at various employers and various clinics before, starting my own practice where I'm at now. And throughout all of that, I was kind of going and just meeting people. I love to network. I love to
Mm-hmm.
talk to people and kind of give people an idea of who I am and what I can do. And so that's sort of how I built up my network just over the last couple of years, just really pounding the pavement and meeting new people. Every patient that I get, whether it's a referral or somebody just finds me off the internet, I'm constantly asking, like, how'd you find me?
Mm-hmm.
Who are you? Like, who else is in your care team that is helping you through this? And so if it's somebody that I haven't met, I'm reaching out to those people that it's all about networking. It's all
Mm-hmm.
about who can help, you know, who are like-minded individuals that can help you, that are seeing the same clients as you.
That's good. That's a good tip. Networking and trying to put out your name as much as you can. So you're in your practice in Flex PT. Um, you're seeing all gender in pelvic floor health. What is the percentage of that men and women?
Sure.
Mhm.
So right now, it's probably about 75% pelvic, 25% ortho,
Mhm.
orthopedic dysfunction, just general, kind of run of the mill orthopedic dysfunction. And
Mhm.
then of the pelvic floor, I'd say it's about 75% men and 25% women that I'm
Oh,
seeing. So most of my
okay.
caseload is male pelvic floor disorders,
Oh, good.
which not that I'm not like heavily marketing that. That's just
Mhm.
sort of who's found me, I guess, and
Mhm.
my referral network, like I was talking about.
Good.
Um, so yeah,
Mhm.
it's been good. I love treating all, pelvic floor
Mhm.
things.
Mhm.
All things pelvic floor is kind of what I hold dear, but my male pelvic pain patients,
Mhm.
like those are my favorites. I know you're
Mhm.
not supposed to have favorites, but when I see a male pelvic pain diagnoses come in, that's what I kind of get excited
Uh,
about.
wow, that's surprising, but that's also refreshing hearing that most of your patients are men, and they, that surely there's a need for it,
Yeah,
for having a male practitioner in the men's health pelvic floor world.
yeah. It's interesting. So you had mentioned that article earlier about the Herman and Wallace. Herman and Wallace put out an article about
Mm-hmm.
male providers and
Mm-hmm.
pelvic health, and a lot of men, and I'm just kind of lumping here, not
Mm-hmm.
want to be stereotypical, but a lot of men, at least in my experience, have voiced that they appreciate someone with, the same anatomy as
Mm-hmm.
them being able to relate
Mm-hmm.
to the dysfunctions that they're having.
That's true.
Some of my patients have really appreciated the fact that I have the same equipment that they have, and that when things aren't working
Mm-hmm.
exactly the way they want it to, I have the equipment that I can kind of relate to.
Mm-hmm.
Um, Again, that's very gender, stereotypical, and I try to avoid being, so binary,
Mm-hmm.
but a lot of my cisgender men
Mm-hmm.
really appreciate the fact that I have the same equipment and I know the anatomy and I have the background and the education
Mm-hmm.
to relate to
Mm-hmm.
their problems.
Mm-hmm.
So that's been interesting to see.
I guess it's the same with the cis female patients who would go to or prefer women in
Exactly.
terms of pelvic health, because they would feel that their concerns are being understood because they have the same anatomy.
For sure.
So,
And so with that, like I said, about 25% of my pelvic floor caseload is female pelvic
mm-hmm.
floor dysfunction.
Mm-hmm.
And, just like, I mean, everybody's got preferences, but
Right.
some people just don't care. And
Uh-huh.
most of my women, well, all of my women that I'm seeing clearly, they don't care who's
Mm-hmm.
helping them. They just want to get better.
Right.
So I don't want to like box people in and
Right.
say that, like one gender or one person prefers. It's honestly preference and what
Right.
people like, who's going to help them get better.
Mm-hmm. Mm-hmm. Nice. Have you had patients or met patients that say that, oh, I've seen another pelvic floor PT, but I think I prefer to see you rather than that other physical therapist? Have you had that experience?
I have,
Uh huh.
and I mean, it happens, but
Mm-hmm.
just like, just in any other regular, just orthopedic,
Mm-hmm.
instances, for instance,
Right.
patients can relate better, patients can vibe better with, patients can like a certain therapist treatment style
Mm-hmm.
better than another person. And not that
Mm-hmm.
that other person is doing anything wrong.
Mm-hmm.
They're both probably trying to achieve the same goal. There's just different ways to go about it.
Mm-hmm.
Um, I've had patients come to me after seeing another pelvic floor therapist or other pelvic floor therapists that, it's just ultimately it's up to patient preference. If
Preference.
if they're not seeing results, or if they don't really appreciate the way that things are going at their prior clinic. I've had
Mm-hmm.
patients come to me and voice those concerns, and
Mm-hmm.
again, it's just all about preference, what patients prefer.
Mm-hmm. That's right, right. So, good one. It's that you have more men coming uh, to you for physical therapy because there's really that need there. But of those patients, um, are all of them receptive to internal assessment, or do you still have to tell them go through all the you know convincing or describing what it is for and what it can do?
Sure.
Mhm.
I mean, I personally haven't had any kickback from any
Mhm.
patients. I
Mhm.
feel like I'm only I'm pretty direct.
Uh-huh.
I speak frankly, but I'm also
Uh-huh.
pretty direct about to patients. If I think that they will benefit
Mhm.
from from an internal assessment or
Mhm.
internal treatment, I mean, I say it up front, like, listen, I think you would really benefit, or that your symptoms would benefit from an internal assessment and treatment.
Mhm.
I haven't had anybody. I mean, as of now, fortunately, I haven't had anybody refuse that.
Uh-huh.
I think patients know coming in that they have an idea of pelvic floor,
Mhm.
what that entails, but
Mhm.
it's not until, and I'm very, I, a lot of, so I spend my initial evaluations with pelvic floor patients are 90 minutes. And
Mhm.
so I spend most of that time is just talking and
Mhm.
education.
Mhm.
And most of that time is explaining what the pelvic floor is, what
Mhm.
exact, like why that they're there, why they were referred to pelvic floor therapy, and how I can help them achieve the goals that they want to achieve.
Mhm.
And so after a lot of education, a lot of talking, I explained to them, what I would like to do, if you're okay with it, is
Mhm.
do a pelvic floor exam
Mhm.
that involves an external and an internal exam.
Mhm.
And here's why. Like, here's why that I think that this is needed or indicated.
Mhm.
And, spending 90 minutes with people and talking for most of it, I think when people feel heard
Mhm.
and people feel, you have to build, just like with any therapy, you have to build that
Right.
rapport.
Mhm.
Even more so, I would argue, with pelvic floor therapy, because it's such an
That's true.
intimate experience.
Mhm.
So there's a lot of rapport building. You have to create space for people to feel comfortable enough to let you, do the things you need to do to help them.
Mhm.
And so, with all of that being said, I haven't had anybody refuse an internal exam that I thought would benefit from one.
Gotcha. Right. Recently there was a uh, discussion on physical therapists refusing patients of certain gender. Pelvic floor physical therapists refusing treatment for a certain gender. I think it was posted in one of the physical therapy groups in Facebook, and the I think the premise is that some probably female physical therapists refuse to treat male physical therapists, and some male physical therapists refuse to treat some female patients. Um, and the question was, is that ethical, or is it something that we should force physical therapists to do to see all gender in their pelvic floor practice? But so for you, as a pelvic floor physical therapist, what is your take on that?
That's a very good question, and
Mm-hmm.
that's one that I don't want to say grapple with, but it's always in the back of my mind.
Mm-hmm.
I know you found me on TikTok, and so I recently posted a video series about this very topic. And let me start by saying that with the Me Too movement and the
Mm-hmm.
whole Michigan State gymnastics team and Larry Nasser incident, I am very cautious
Mm-hmm.
about those. people with vaginas coming to see me and making it very clear and making the expectations and what is therapeutic
Mhm.
about what we're intending to do.
Mhm.
So I know like sexual assault and all of that is weighs heavily on people's minds,
Mhm.
especially my female PT colleagues that are in
Mhm.
pelvic health. A lot of my colleagues and friends don't see male patients because of that very instance, not necessarily them doing anything wrong, but because
Mhm.
of the male patients being inappropriate or
Mhm.
making advances that aren't
Mhm.
therapeutic.
Mhm.
Um, for me personally,
Mhm.
I want to be as inclusive and I want to be a safe space for anybody that needs help.
Mhm.
Um, it it may be a risk that I'm taking by seeing all genders,
Mhm.
but again, I'd like to think that being a good person and educating out my eyeballs about what I'm doing and why I'm doing it
Mhm.
is going to create an environment that people feel welcomed and people feel safe
Mhm.
and heard and understood.
Correct.
Um, and it's also a fine line of of saying that you're only going to treat one gender versus the other, because there are those who don't identify with one gender or the other, and gender, is on a spectrum. And
Right.
I market heavily, and I am a huge proponent for the trans population and making sure that they get the care that they need. And so if you start to say that you're not going to see an entire gender because of fear of some sort of kickback,
Mhm.
then what are those who fall in the middle, or fall to somewhere else other than just that category?
Mhm.
It becomes very exclusive. And
Right.
I try as hard as I can to be an inclusive provider
Mhm.
regardless of who I'm seeing. So I don't know, maybe I'm naive, maybe I'm just like I have too much of a bleeding heart, but
Mhm.
me personally, I see all genders and I
Mhm.
market that because
Mhm.
if somebody feels more comfortable seeing a male than a female pelvic floor physical therapist, then who am I to say that I'm not going to treat you
Right.
because I don't feel safe or comfortable
Mhm.
being in the same room alone with you,
Mhm.
you know?
Right.
Again, I also think having that not many people can say that being queer is a benefit, but in this
Mhm.
aspect, being gay, I feel
Mhm.
like also adds to my like layer of my feeling of safety, I guess,
Mhm. Mhm.
because I would hope that a female wouldn't accuse me of any sort of sexual misconduct,
Mhm.
because that's frankly just not what I'm interested in. So um again, I feel, I guess, fortunate in that
Mhm.
aspect
Mhm.
that I have that as part of my, who I am, my identity, because
Right.
it's it's not something that I'm concerned about.
Mhm.
But
Mhm.
I know that I have other straight male pelvic floor colleagues that take extra layers of precaution, that have techs or assistants or aides
Mhm.
that either sit outside the room or in the room with them whenever they're
Right.
doing pelvic floor exams,
Mhm.
or pelvic floor treatment.
Mhm.
And so I it's very clear,
Mhm.
like I mentioned, it's very clear when patients come to see me that
Mhm.
they are seeing a male provider. Like,
Mhm.
there are so many, I take so many steps before patients even get into my door that they know that they're seeing a male provider. So if they're there for me, it's because they want to be.
Mhm.
And I feel like I just sort of word vomited a lot, but it's a topic that I get asked a lot, and
Mhm.
I have a lot of feelings about it.
Mhm.
So, um,
Yeah.
in terms
Yeah.
of my female colleagues, though, I don't think that you can't force anyone to treat, anyone
That's true.
if they don't feel comfortable. Like,
Right.
if I was forced to treat somebody, that would make me angry.
Mhm.
I don't like necessarily being told what I need to do or what I have to
Mhm.
do.
Mhm.
I do things because I want to do things.
Mhm.
And
Mhm.
if my I feel like it would be a disservice to force PTs or female, PTs to treat male patients,
Mm.
even if they're uncomfortable with it.
Right.
But then on the other hand, you do have these male patients that genuinely do need help and care. And a lot of times there are only female pelvic floor therapists around.
Mm-hmm.
So it's kind of a catch-22. It's a double-edged sword. Like
That's
whose interests come first?
mm-hmm.
And I don't have the answer for it. I'm not an ethicist, so
Yeah, right.
um, I can only speak for me personally, and I try to
Mm-hmm.
be inclusive as I can. And I guess that also goes into a little bit of privilege, like my privilege of being a male provider. I feel safe around everyone. I'm not constantly thinking about, is this person going to assault me, or be um, take things the wrong way,
Mm-hmm.
or you I don't really think about that, and I
Mm-hmm.
take that for granted because a lot of my female colleagues are always
Mm-hmm.
thinking about, whenever with their male patients, like, are they going to get an erection? Are they going to
Mm-hmm.
be inappropriate?
Right.
Are they going to make advances on me and I'm going to have to cut the session short?
Mm-hmm.
Like, I have conversations with my friends and colleagues about this all the time, and again, I sometimes take it for granted that I'm not really ever worried about those things because I am a man. And
Mm-hmm.
but
Right. Well, yeah, that's true. I agree with you that there's, as it's good that you're really just striving to be like inclusive to all gender, but yeah, but other pelvic floor physical therapists might have some, we don't know if they have some history, traumatic history or something. So for me, I guess it's also a matter of being like comfortable or what they're trained for, or what are the logistics in their practice, if they have extra people to like come over to watch them do the assessment. So I guess I kind of understand um, where they're coming from in refusing a certain gender in their practice. They might do a disservice if they're not really sure of a certain like anatomy, for
yeah.
example. So better refer them to those who are really in that lane. So, talking about men's pelvic floor, men's health, what are the common conditions that you encounter in your practice in terms of men's health?
So I see a lot of pelvic pain.
Mm-hmm.
It's funny. Well, it's not funny. It's interesting that currently, right now, my caseload, I have 4 testicular pain patients on my caseload. And I mean, diagnoses come in waves.
Mm-hmm.
I mean, just like ortho, different diagnoses come in waves. But right now, I have testicular pain. I have just general pelvic pain. Um, I have a few erectile dysfunction patients. I have a few, I have one pain with erection and ejaculation.
Oh wow.
Um, I'm trying to think. I've got some constipation patients from that are, driven by overactive pelvic floor, among other things, but the driver is an overactive pelvic floor, some outlet dysfunction.
Mm-hmm.
I have a few post prostatectomy patients with erectile dysfunction, ED, and some urinary incontinence that we're working on. So it's kind of a mixed bag.
Mm-hmm.
I'm not going to say I have, one diagnosis over the other, but
Right.
I'd say pelvic pain, testicular pain, pain with
Mm-hmm.
erections, a lot of pain patients,
Mm-hmm.
not a lot of incontinence, or
Mm-hmm.
there's a couple, like I said, constipation, but mostly sexual dysfunction patients and
Mm-hmm.
pelvic pain. That's probably the biggest category of patients that I have right now.
And of those patients, what are your usual age range? Are these the mostly the older adults, or do you see like young adults as well?
No, in my history of being my short history of being a PT, I'd say the average age range of
Mm-hmm.
patients, late 20s to like 40s, 50s.
Mm-hmm.
I'd say my older population tends to be more of my post-prostatectomy patients with some urinary incontinence and
Mm-hmm.
ED.
Mm-hmm.
But like pelvic pain and like sexual dysfunction, or pain with orgasm, ejaculation, erections, that's
Gotcha.
tends to be my like late 20s to mid 40, early 50 range
Mm-hmm.
patients.
Mm-hmm. I see. So it's really varying for each age range. Oh.
Yeah,
Mm-hmm.
I don't see, I mean, I can't think of any patient that I've seen that was under the age of, you know, I think the youngest patient I've seen is 24.
Mm-hmm.
So most of my patients are mid 20s and above.
Mm-hmm.
And I don't treat peds or pediatrics. I don't anything under 18 I refer out. That is where I draw a line. Gender I'm fine with, but anything under 18 I refer out, because
uh-huh.
it's just me. I'm a solo practice and I don't want to take, that's a risk I'm not willing to take. So
Mm-hmm.
um, I refer that out. But
Mm-hmm.
typically my patients are mid 20s and above.
Gotcha. For it's probably maybe some people would encounter this podcast and wonder about pelvic floor. What are the things that men should take note of if they observe something different about their pelvic floor, or what are the common signs and symptoms men should take note of to know that they should see a pelvic floor physical therapist?
That's a good question. Any kind of pain, any kind of pelvic pain is definitely, if you've seen your medical provider and they've done all the tests and they've ruled out all of the some or all of the sinister things that it could be,
Mm-hmm.
then I would push for to see a pelvic floor therapist, because a lot of oh, it's sad, a lot of my male pelvic pain patients, a lot of times they found me on their own, or it
Mm-hmm.
wasn't until like the fifth, sixth, seventh. I had one guy tell me that I was the 10th person to see him that like
Wow.
finally helped him with the symptoms. The
Mm-hmm.
10th medical, someone in the medical industry
Mm-hmm.
realm that he had seen before he finally got the help that he was looking for.
Mm-hmm.
And it's just so frustrating because not a lot of our medical field knows about pelvic floor therapy and the things that it can do and the things that it can help. So yeah, any kind of pelvic pain that can't be explained by a medical diagnosis or, any sort of medical test, I would push for a referral to pelvic floor therapy. Like when I say pelvic pain, I'm talking about like pain with an erection or pain with ejaculation or orgasm.
Mm-hmm.
Perineal pain, pain with urination, or pain with bowel movements, all
Mm-hmm.
of that is not normal and should not be just kind of, swept under the rug, which I've heard a lot of from my male patients that, they had one provider that said, "Oh, that's normal. Like it'll be fine. Just here's some
Wow.
antibiotics for it." A lot of pelvic pain, especially male pelvic pain, gets kind of written off as a UTI
Mm-hmm.
or um, prostatitis. I could go down a whole podcast on prostatitis and my thoughts about it. But a lot of my male pelvic pain patients get or get prescribed antibiotics, and if there's no infection, why are we giving patients antibiotics?
Mm-hmm.
It's
Right.
but anyways, so yeah, pelvic pain, like I said, pain with erections, orgasm, climax, ejaculation, pain with urination, bowel
Mm-hmm.
movements, and then more, I guess, kind of not sneaky, but things that patients wouldn't necessarily think of as being pelvic floor dysfunction or urinary urgency and frequency. I have a few men on my caseload that say that, they have to pee all the time,
Mm-hmm.
regardless of how much fluid they take in. They
Oh, okay.
always have to pee. And when they have to pee, it's like a 10 out of 10 urge to pee. So urinary urgency, frequency, anything above, the realm of peeing 9 to 12 times is what we kind of 9 to 12 times over a 24-hour period.
Mm-hmm.
Well, 9 to 12 times over waking hours
Mm-hmm.
is what we consider normal or average. And so if you're peeing more than that, like every 30 minutes or every hour, that's not normal.
Mm-hmm.
Post void dribbling, that's a big one I see,
Right.
where you're going to the bathroom, you finish peeing, you put your equipment away, and then as soon as you put it away and walk away from the urinal or the toilet, you dribble a little or you leak a little bit, you wet your underwear. That's not normal. It happens a lot in the male population, or those with penises. It happens a lot.
Mm-hmm.
And
Even
so
those who are not in the older
yeah,
population.
yeah, I
Oh,
see that more actually in
oh
the younger
really?
population, that
Uh-huh.
they've got post void dribbling where
Mm-hmm.
they leak a little bit whenever they finish. You
Mm-hmm.
shouldn't be leaking on your underwear when you finish going to the bathroom. Um, so yeah, that's I guess, again, could go down a rabbit hole of a bunch of diagnoses, but
Mm-hmm.
constipation is another one that pelvic floor therapy can help with. If
Mm-hmm.
you've seen a colorectal, physician, and they are ruling out all these tests that everything is quote unquote normal.
Mm-hmm.
Outlet dysfunction is something that where the pelvic floor muscles don't allow the bowels to move or to evacuate, and
Oh.
so the the pelvic floor isn't relaxing all of the way to
Mm-hmm.
allow patients to have a successful bowel movement.
Mm-hmm.
And so that is something that I see in the clinic, is
Mm-hmm.
outlet dysfunction.
Mm-hmm.
um, I'm trying to think. Those are some of the more common diagnoses that I see that patients would experience. And then also, anytime, I would argue that any patient that undergoes a prostatectomy, that has prostate cancer and gets their
Mm-hmm.
prostate removed, you're getting about an inch of your urethra cut out
Uh-huh.
because it goes directly through your prostate. So if your prostate's taken out, your urethra is getting shortened, and that skeletal muscle, the internal urethral sphincter, sometimes gets taken out. And so if you lose that kind of that bridge of
Mm-hmm.
that backup, gate of the floodgates, if that gets taken out and you're peeing on yourself, like some doctors will say, so I've heard some physicians from patients say that, that'll come back, that'll get better, it'll get better.
Mm-hmm.
And sometimes it doesn't, and
Mm-hmm.
they need help
Mm-hmm.
learning how to get better. So
Right.
um, if you had a prostatectomy and you're still having issues with incontinence or even erectile dysfunction, not able to get a full erection,
Mm-hmm.
sometimes pelvic floor therapy can be beneficial as well.
Right. Okay. So, as yeah, going back again to probably some patients or people interested in men's health come across this podcast, what would you say is a good advice for men how to take care of their pelvic floor as a general advice?
Well, I guess my answer to that would go see a pelvic floor therapist.
Mm-hmm.
I mean, I am a huge proponent of preventative,
Mm-hmm.
just like wellness
Mm-hmm.
screens. And whether you think you have a problem or not,
Mm-hmm.
just like you go to see your physician for a checkup, like
Mm-hmm.
what's it going to hurt to go see a pelvic floor therapist? A lot of times, and again, I would argue that, and I don't feel like enough ortho PTs do this either, should be pushing kind of wellness screens on people, like
Mm-hmm.
yearly or quarterly or biannual, just
Mm-hmm.
check-ins.
Mm-hmm.
You go take your car to get an oil change, every so thousand miles. Like,
That's true.
why not maintain your body? We put so many miles on our bodies and we're doing so many things all day long, every day.
Mm-hmm.
Like, why not go, just go see a therapist that
Mm-hmm.
can do a movement screen or
Mm-hmm.
do any sort of like wellness or preventative checkup. Again, I have a lot of thoughts and feelings about this, but for pelvic floor specifically, like, I don't want to give out any sort
uh,
of blanket statement of
like I
what
said.
patients can do,
Mm-hmm.
because a lot of times when people think pelvic floor dysfunction, they think the answer is to do, Kegels. Like,
Kegels.
just do
That's
your
true.
Kegels.
That's true.
Well, for one, patients a lot of times don't know what they're
Well,
doing when they're doing a Kegel. Like,
mm-hmm.
you patients may think that they're recruiting the right muscles, but a lot of times they're not. They're
Mm-hmm.
compensating with, abdominals or glutes or inner
Mm-hmm.
thigh muscles.
Right.
And so a lot of times patients will just think, well, I should just do Kegels. And
Mm-hmm.
that's not always the answer, because you're probably not doing them right. And
Might not be
this,
doing good.
yeah, you might not be. So in my clinical experience, my practice, what I see a lot of,
Mhm.
and I don't want to be too expletive, but most of my men are tight asses, like literally like hold so much tension in the pelvic floor that they don't know how to relax, and that
Mhm.
is contributing to a lot of their symptoms.
Mhm.
And so patients are like, well, if I'm having these issues, I should just be doing Kegels, when you are you're you're over recruiting an already overactive muscle group.
Gotcha.
So a lot of times I teach patients how to just relax and
Relax.
lengthen the pelvic floor and
Mhm.
give it some, some room to breathe. Because if you're always kind of stuck up in this heightened overactive position, a muscle, just like the pelvic floor is a muscle, a group of
Mhm.
muscles, just like every other muscle in the body, that has to go through the full range of I'm doing this, I don't know, listeners can't see me, but I'm bending my elbow because of the bicep. That's the example that I give everywhere, or to
Mhm.
every patient. Your bicep has to go through the full range of motion to be functional, to eat, to drive, to put
Mhm.
on clothes. You got to be able to bend your and straighten your elbow.
Right.
Your pelvic floor has to be able to contract and relax as well. And a lot of times I see patients are able to contract, but relaxing and lengthening and giving it that full range of motion is really, really difficult.
Mhm.
At least that's what I see clinically a lot.
Mhm.
So a blanket statement, I can't I can't really advise on, because
Mhm.
it wouldn't
Right.
necessarily be accurate.
So go see your pelvic floor physical
Go
therapist
see a pelvic floor therapist.
if you feel or sense something strange
Correct. Yes.
down there.
Yes. Yes. Just
So
go for a consult.
right. But I agree with that. If you're like, if we're taking our car to the auto shop for maintenance, why can't we just like do that to our bodies? Makes sense.
100%.
So for probably physical therapists, or specifically male physical therapists who are interested in going to um, pelvic floor, men's pelvic floor, men's health, what can you advise them?
It's a huge need. There's a huge need for it. There are so many patients that need help, and in a lot of areas, in at least in our country, in a lot of areas, it's mostly predominantly female pelvic floor therapists. So if there are male pelvic or male physical therapists that are listening, that are interested in, getting into pelvic floor, I mean, do it. Just just do it. If
Mhm.
anything, take a male pelvic floor course and learn. Just kind of get your toes, dipped in the water and
Mhm.
see what it's all about. And it sounds like something that, is remotely interesting to you, then I would say go for it, because there's
Mhm.
a huge need for it. There are patients everywhere that need help.
Mhm.
I mean, example being, again, my TikTok is, it's crazy how social media works, but through that I've been able to reach, thousands of people, and
Mhm.
I get DMs, messages from people, specifically male patient or male, people all the time, those with
Mhm.
penises, ask, like, saying, oh, I wish you were closer, I would definitely come see you, or
Ah,
I'm only able to see a female therapist. And I mean, my inbox is full of people, mostly men who
uh-huh.
identify as male, reaching
Mhm.
out to me, that are saying that they wish I was closer, or they wish that there was a male provider closer that they could see. So I'm a huge advocate for men going into male pelvic floor, strictly, I mean, mostly because there aren't enough of us doing it.
That's right. All right. Good. So again, um, we're already at the end of our interview, and thank you again for sharing your experience and what you know, your practice in men's pelvic floor. And yeah, we can still talk a lot more about different topics
I know,
under
that
that.
hour went by so fast.
I know. I have a lot of questions that I want to ask you, but yeah, but thank you for having this time for us, and at least we have an idea that there's really a need for male practitioners to practice in pelvic floor. Just a last question that I have for you. It's coming from the name of the podcast, PT Meal. So, what are the three ingredients that you feel are essential, you carry with you every day, that three ingredients that make up who you are? It can be a belief, a principle, a motto, or a characteristic, an attitude. What makes up Dr. Lance Frank?
That's a good question. I would say compassion. I try to be a compassionate. I'll say compassion slash empathy.
Mm-hmm.
Compassion slash empathy. I try to be a compassionate and empathetic provider. Um, Number two, I would say drive. I'm very driven. I I like I like to lead and lead by example, and that's always been who I've been. Very
Mm-hmm.
for better or worse type A person. I like to be, again, I'm very driven, I'll say that. um and then C, three, whatever, which one we are.
Third one, yeah.
um I just try to be a good person. At the end of the day, being a good person can take you a long way. Just be kind. I try to be kind to everyone, and I just ultimately try to be a good person. And I
Mm-hmm.
feel like at some point in time, karma will, pay its respects to me if I'm just a good person to people.
Mm-hmm. All right. Compassion, empathy, being driven, and being a good person. Three
Yep.
things that make up Dr. Lance Frank. All right. Again, thank you very much for being in the show. For those who want to try to reach you, what are your website or social media?
Yeah. So my website is flexptatl.com. That's where you'll find kind of all about me and my practice, and um, my my socials. Instagram, Flex PT ATL. That's my business one. My personal one is Lance_Frank. Um, TikTok, Lance in your pants.
Oh, that's a
that's
good one.
that's my TikTok name. Kind of funny,
Mm-hmm.
humorous, plays on pelvic PT.
Mm,
And then
sure.
you can, if patients are interested, they can shoot me an email, lance@flexptatl.com.
All right. Well, and all of that we're gonna put there in the show notes, show description, and the podcast. Again, thank you very much for your time, Lance.
No problem. Thanks for having me.